Hello, scholars. Talking about the urinary system today. So let's get going. Just like we normally do, we're going to talk about structure and function. What are the parts, structures of a system, and what do they do? Their functions. So, urinary system is going to maintain homeostasis. Now, homeostasis is a big concept. It's keeping your body normal and regular and optimal. How does the urinary system help do this? Well, it's going to regulate the water balance in your body. Too much water, you're bloated, you don't feel very good. Too little water, you're dehydrated, you don't feel very good. So, your urinary system helps to regulate the right amount of water in your blood so that you're feeling good and healthy. How does it do this? It's going to produce, store, and eliminate urine. What's urine? You kind of know what urine is, but scientifically, this is the liquid waste of all your metabolic functions, your metabolism. All that getting and using energy creates waste products. Okay? There are liquid waste, there's salts, sometimes hormones are in urine. Okay? So the urinary system is the whole system to produce, store, and eliminate urine. What are the big players? First is your kidneys. Your kidneys are the organs that filter your blood. They're connected to the ureters, which are tubes that carry the urine from your kidneys down to your bladder, your urinary bladder. That's where you store the urine until it's time to urinate. And then urethra is the tube that eliminates the urine from your body. Okay? Got a small picture here. Blow it up. Don't really need to know all the details here, but I kind of like for you to see it in perspective and a little blown up. Notice, here's your kidneys, kind of shaped like kidney beans. That's why they named the bean like that, because they look like a kidney, not the other way around. Okay, they're on either side of your spine. They're connected to the circulatory system, the arteries. That's really, really important. And the kidneys connect through the ureters down to your bladder, and then out the body through the urethra. The tubes and the parts are the same whether you're a male or a female. It's just how they're externally connected, if you get what I mean. All right? Cool. How do the kidneys filter the blood? Well, the kidneys have millions of these things called nephrons. These nephrons are the functional unit of the kidney. They're a bunch of tubes that are designed to filter the blood. Okay? Around these nephrons, here's a nephron right here, okay, and they're surrounded by capillaries. Remember that the capillaries from the circulatory system are the leaky blood vessels. They allow the plasma to ooze out of the vessel, and along with that, the water, the sugar, the nutrients, the wastes, the salts, the hormones, everything that's dissolved in that plasma comes out up here at the top of the nephron. And so the nephron has this tube that goes down in the kidney and back up the kidney and then to the collecting duct. So the good stuff, which comes out up here at the top, goes back into the capillaries. See, it's surrounded by capillaries. The sugar, the water that you need, the hormones that you need, the nutrients that you need go back in. So we dump everything out. It's like a messy drawer in the desk. We dump everything out on the table. The good stuff goes back in the drawer. The bad stuff goes into the garbage. So the nephron is going to hold on to the things that you don't want in your blood. The urea, the unwanted salts, the unwanted water. Because although we need water, we don't want too much. Okay? These nephrons drain to the ureters, through this collecting duct over here. And it gets concentrated from urea into urine. And then you go number one. You expel the urine from your body. That's called urination. Now, if you want to draw, I'll put the picture up for you. Do I really care about all these labels? Not so much. What I do care about is here's my nephron. Okay, it's a tube that goes down into the kidney, comes back out, connected to a collecting duct, which goes to the ureters. I also care that you know that it's connected to the circulatory system. Here's my artery coming in. Here are my capillaries surrounding it. The capillaries pick up the good stuff and go on their merry way. The bad stuff stays in the nephron and goes out through the collecting duct to the ureters. Cool? All right. Let's see if you're actually listening or see who actually labels all these details over here. All right. What are some diseases or disorders of the two systems? Let's start with the urinary system, since that's what we talked about for the last two slides. You can have a urinary tract infection. That's where you have bacteria that are growing in your urethra or your bladder. Okay? Bacteria comes from that hole on the outside, and they start growing. They like warm, dark places, and they start growing and growing, and it makes it burn when you pee. It's not good. If your pee ever burns, tell your parents, go to a doctor, get some antibiotics. Fairly easy to take care of if you do it early. If you wait a long time, it's harder and harder to deal with, causes more and more problems. You probably won't get kidney stones at your age, but as you get older and your kidneys, get a little slower, then you can have these things called kidney stones. And that's when I'm concentrating salt in those collecting ducts, which will lead to my ureters. But we know that salt can crystallize. If I'm not drinking enough water, okay, to dilute those salt crystals, then they form. And the salt crystals have sharp, jagged edges. And when I push the water through, it drags that crystal through my ureters, and it hurts. Okay, they're really painful to pass. Most of the time, you can pass them normally. Hurts a little bit. But sometimes you need to go to the doctor, and they can use ultrasound to shatter them up. But the key is to really stay hydrated when you're doing that. And usually you can dilute the stones. All right, my case. You can also have kidney disease, all right? Kidney disease is when you actually damage those nephrons in the kidneys. A lot of times that's from diabetes or high blood pressure, but there's other reasons too. And what that's going to do is it's going to make it hard to regulate the balance of water in your blood. Too much water, bloated, don't feel well. Too little water, I'm dehydrated, don't feel well. So kidney disease really can complicate other matters because you're not getting the waste out of your blood or not regulating the water in your blood. Okay? There are other disorders or diseases, but this is just a few. And we'll talk about the digestive system. All right, now I know what you're all thinking. Oh my goodness, Mr. Tamer, there's so many words on this slide, but guess what? I think it's a good thing. Do you really want to see pictures of diarrhea and constipation and vomiting? Nah. So let's go with the words, shall we? Sometimes a dozen words is way better than a picture. Okay, so what the heck is diarrhea? Diarrhea is when the water doesn't get taken out of your feces. The large intestine, the colon, isn't doing its job. All right? This could be because of a variety of reasons. All right? Maybe there's an infection, or maybe you're allergic to that food, and you just need to get it out of your system pronto. Or maybe you have the flu, and you know there's virus in that feces, so you want it out as quick as possible. So if it's beyond that sphincter between the stomach and small intestine, comes out the other end. Diarrhea. Ew. But now you understand. Constipation is the other situation where too much water is taken out of the feces. It gets really hard, and it's hard to go, number two. Okay? There are certain foods you can eat that naturally help stimulate you to poop, like prune juice. Okay, but diarrhea and constipation are opposite sides of the same problem. How much water is in your feces? Heartburn, different type of problem. So heartburn has really nothing to do with your heart, but it's right here in your esophagus, and your esophagus goes over your heart. So people say, oh, my heart is burning, but really it's acid from your stomach, and that sphincter, that muscle that closes your stomach, leaks a little bit. So when acid comes out of your stomach and starts going up your esophagus, it starts getting an acid burn, and it hurts after you eat. And so that's what heartburn is. Okay, it really has nothing to do with the heart. It's all about the esophagus, the tube that connects your mouth down to your stomach. Last but not least, vomiting. All right, this is the body's way of saying, I don't want this right now in my stomach. Maybe it's poisonous. Maybe you're allergic to it. Maybe you're sick and fighting the flu, and your body's like, I can't deal with this right now. And it comes out the opposite way. Essentially, if the food is in your stomach or before, you vomit, If it gets past your stomach into the intestines and you need to get rid of it, it's diarrhea. 2 ways that your body gets rid of things it doesn't want in your digestive tract. Cool? All right, so no picture, double words. Sorry, but I don't think you wanted it the other way. All right, quick review. You need to know the structures and functions of the urinary system. What are the main parts? What do they do? You want to have a general understanding of how these kidneys filter your blood. Has to do with the circulatory system. Okay? Dump everything out, the good stuff back in the blood, the bad stuff goes to the bladder. Okay? You want to know some examples of those diseases and what's wrong with the system and why you get those symptoms. Cool? If you have questions, associated reading, chapter 24, sections 2, disorders for the digestive tract will be in section 1. You're in the 640s for your reading. All right, write down your questions. See you in class.